My name is Dr. Harihara Murthy. I am a practicing ENT specialist living in Bangalore, and I have been in this profession for more than 30 years. Nasal obstruction is one of the most common problems many people face. It could be because of simple things like a bad cold, which is causing a swelling up of tissues in the nose as a result of blocking the nose and causing difficulty in breathing, especially so at night. It can also be caused by inherent structural issues within the nose, like deviated nasal septum, the middle wall of the nose being bent out of shape, not in the midline, pushing to one side because of extra growth of bone. As a result of that, there can be obstruction. Turbinate hypertrophy is another common problem that one does encounter. In the case of a narrow nasal cavity, when there is a turbinate hypertrophy, there is not enough space to accommodate the increase in size of the tissues within the nose, as a result of which there is an obstruction to nasal airway. Sometimes a ballooning of tissue within the nose we call conchobullosa can also cause an obstruction. These are normal structures, abnormally shaped and sized, as a result of which you can have difficulty in breathing. Apart from that, nasal polyps, which are abnormal growths which are seen in case of infections as well as in allergies, can cause obstruction. There can be growths in the nose such as tumors that can also cause obstruction. Adenoid, which is normally seen in children between 2 to 4 years of age, can persist beyond 4 years and cause nasal obstruction. This is an abnormal situation, abnormal size in the wrong age. Between 2 to 4 is absolutely normal. So an adenoid can sometimes be encountered in adults as well, and I have removed adenoids even at the age of 40 in certain people, not always. So identifying the causative factors is very critical. If it is of infective origin, treating with medication is required. Even an allergy, living in a city like Bangalore, even if you go out and develop an allergic reaction and you have irritation in the nose and swelling up of tissues, you can have a nasal obstruction. So that has to be identified and treated, if possible prevented. But if there is a structural problem in the nose which is causing difficulty in breathing, it may show up in a routine examination with a person who comes with a recurring sore throat. A person with a recurring sore throat or recurring sinusitis has to be looked at and the cause identified. Many a time deviated septums, hypertrophy tissues, even conchobullosa can cause obstruction of the sinuses as well as other symptoms of obstruction of breathing itself. Snoring is another problem that one does encounter, and it can be aggressively increased if the obstruction in the nasal cavity is not addressed. So what happens in that situation is the person is snoring, so everybody looks at only the snoring aspect. They don't deal with the cause. And many a time the causative factors are in the nose due to one kind of obstruction or the other, and dealing with the obstruction is necessary to make sure the person is able to breathe again and freely. Normally, breathing should be an unconscious and easy, effortless affair. If you are aware of your breathing, something is abnormal there. So, identifying the cause of obstruction is necessary so that you can breathe freely and effortlessly.